Have you or someone you know recently moved, graduated from college, taken a new job, left your parents' health plan, or joined Medicare, which, by the way, many doctors don't accept? Or for any reason, do you or someone you know need to find a new doctor? If so, this video will help you use the internet to find the best doctors in your area. Choosing a doctor can be an overwhelming task, especially in a large metropolitan area where there are literally thousands of doctors and so many online services offering to help you choose. In this video, we start by likening those thousands of doctors to grains of sand until we learn to distinguish them by group affiliation, hospital admitting privileges, and participating providers, for example, all of which help us zero in on quality and cost of care. Emily and her family have moved to the Boston area and need a new healthcare team. She starts by looking for a primary care physician. The diagram shows that there are at least 6 specialties that qualify as primary care physicians, or PCPs. Most health plans require that you choose a PCP as your healthcare manager and gatekeeper. Although many PCPs are still solo practitioners, a growing number are joining multi-specialty medical groups, of which there are over 500 in Massachusetts alone. And group practices offer many advantages to patients, such as extended hours, better coverage, and faster referrals. For those with a medical history, a specialist may be a more appropriate PCP, provided that your health plan permits. Choosing a specialist will take you down a similar path. Many specialists, such as my ophthalmologist, belong to a single specialty group and are often based at or near a hospital to which they have admitting privileges. A major distinguishing factor among doctors are the hospitals to which they have admitting privileges. In the hospital section of Finding the Best Healthcare You Can Afford, we learn that there is considerable variation in the quality of care that hospitals provide. So the hospital or hospitals to which a doctor has admitting privileges may tell you more about the quality of care that he or she practices than any other single piece of information. Emergency rooms, ERs, now more often called emergency departments, or EDs, exist as an adjunct to many, but not all, community and teaching hospitals. Studies show that the quality and speed of care vary widely among ERs, so much so that it may sometimes be advantageous not to go to the nearest ER. Here are the results of an actual case study, but with hospital identities disguised. In our case study, there are 5 emergency rooms within 12 miles. The nearest ER is less than 2 miles away, and the estimated travel time is approximately 6 minutes, according to Google Maps. Hospital B is 6 miles away with a travel time of 15 minutes, and so on. If travel time were the only consideration, a reasonable person would choose Hospital A in the event of a medical emergency. But let's look a little deeper. The Centers for Medicare and Medicaid Services publish data on ERs that includes average time to be admitted and to be discharged. Armed with this data, we see that Hospital A averages 3.1 hours, including travel time, to admit a patient. Hospital B takes only 2.2 hours, and Hospital D just 1.5 hours, both including travel time. Knowing this, would you still choose to go to the nearest hospital ER? What if you're discharged rather than admitted? The same CMS data tells us that Hospital A would keep you for 6 hours before discharging you, longer than any of the other 4 hospitals. So wouldn't this be valuable information to have the next time you or anyone you know has a medical emergency? Emily and her family have just moved to the Boston area and need to choose a new medical team. But she's feeling a little bit overwhelmed. Here's why. There are almost 28,000 active physicians in Massachusetts. In the Boston area alone, there are over 3,200 primary care physicians within a 10-mile radius, and 2,200 within a 5-mile radius. In a suburb such as Dedham, which is about 12 miles southwest of Boston, there are over 400 PCPs within 5 miles. Still too many to choose from. Let's see how Emily can narrow down her choice of doctors using the internet. She starts with 2,200 primary care physicians, or grains of sand, within 5 miles of her new home. But she only wants to consider board-certified physicians, so she applies a filter to her internet source, which narrows the field to 1,760 board-certified PCPs. She then chooses PCPs specializing only in internal medicine, which reduces her choices to just over 1,000. But her choices are further limited to physicians who are accepting new patients, which reduces the number by about 1/3. Having previously researched hospitals in the area, Emily then restricts her choices to PCPs with admitting privileges at Hospital C. This dramatically reduces the number of candidates to about 140. Then, based on additional research, she chooses Medical Group Q rather than a solo practitioner or another medical group. That narrows down Emily's choices to 7 board-certified primary care physicians. Of those 7, Emily chooses 3 for consideration after reviewing their individual profiles. She will repeat this process to find an OB/GYN and a pediatrician. If it's not already obvious, your choice of hospitals is critical to your choice of doctors. We've just seen that admitting privileges are the linkage between doctors and hospitals, and that choosing a hospital first can make it much easier to choose a doctor. And unlike in a doctor's office, there are many ways to measure hospital quality, including extensive data provided by the Centers for Medicaid and Medicare Services, or CMS, on deaths, surgical complications, infections, and readmissions. At least 4 credible sources of safety ratings which combine the CMS data and their own information to arrive at an overall rating. By the way, safety ratings vary from one source to another, so it pays to consult more than one source. And several organizations provide hospital ratings for surgical specialties. One source, for example, covers 17 adult and 10 pediatric specialties. Patient satisfaction surveys that are statistically significant, unlike those for individual doctors. Surgeons rated by the performance in a hospital setting. And we've already seen that emergency rooms are evaluated in a number of ways. For all of these reasons, hospital quality is much more measurable than the quality of doctors' care in their offices. So choosing a good hospital, covered in Section 2 of Finding the Best Healthcare You Can Afford, and the subject of a future video, is essential to choosing good doctors. The recently published research report, entitled Finding the Best Healthcare You Can Afford, is a 150-page guide and reference manual divided into 4 sections, one each on doctors, hospitals, and health plans, and a final section showing how to combine what you've learned in the previous 3 sections to choose a compatible combination of health plan, hospital, and doctor. For more information, visit our website at www.findingthebesthealthcare.com. And thanks for watching.